Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond speaks to Dr. James Fick, the head of orthopedic surgery at the Johns Hopkins Hospital and a former Army colonel. They discuss Fick's work drawing on his military career to set up Maryland's field hospital for COVID-19 patients at the Baltimore Convention Center. Let's listen.
Dr. Ficky, thank you so much for joining me.
It's my pleasure, Stephanie. Thank you.
So this is an unusual operation to set up a field hospital in a convention center in the middle of a city. But you have experience in the Army setting up field hospitals quickly. Can you tell us a little bit about that?
Well, sure. I think we're in unusual times. And so I will tell you, I came to Johns Hopkins in 2013. I was in the military for about 30 years. Fortunately, had my medical training, but also a lot of leadership training. And I ended up having the privilege of leading a combat support hospital, which is now what the Army refers to as a field hospital in northern Iraq in 2005. And we had essentially a 250-bed facility that was at the head of the airfield up in Mosul. And our responsibility was to take care of everyone that came in for all hazards. So it was, in that setting, it was all the people, over 400 people, that were responsible for supporting our soldiers, but also the local nationals and a lot of areas that were really illnesses as well as trauma. So, I think that was the background that led to me getting the ask, as it were, from leadership at Johns Hopkins to set up this hospital now to treat our patients that are recovering from coronavirus infections. And here we are.
And you are leading this effort with, I understand, a physician from the University of Maryland who also has similar background as you.
Yes, this is a real privilege. In March, Governor Hogan decided and declared the state of Maryland in a state of emergency because of the coronavirus pandemic. And we were asked, along with University of Maryland system, to co-operate a field hospital that was licensed by the state of Maryland, that was owned by the state of Maryland, but that would be located in Baltimore City in order to be a part of the surge plan. His plan was for 6,000 additional beds in the cases that were worst modeled trends that we were concerned with the pandemic and the local care of patients. And so Dr. Chuck Callahan, who is Vice President of Population Health for University of Maryland, was a career Army officer. We were both colonels, and we both had served in Iraq at different times, but in similar leadership positions. He was selected from the University of Maryland side, and I was selected from the Johns Hopkins Health System side. And we've known each other for many years, and it was a privilege to start the planning together for this.
So how long did it take to set up this field hospital? How large is it? And how do you do this? Like, you're starting from scratch. You're in a big room in the convention center.
Sure. Well, there's not a cookbook for this, but there is a deliberate process. How long did it take? We really started planning this the first part of April, and and maybe into the latter part of March. But essentially, we had it up and running within 4 weeks of the of the order. How do you do it? You pick up a team first. I would say that we had just a tremendous pool of resources to do that. I would tell you that we went back to where we had grown up and thought about this in a military structure, but not a military organization. And so you need to think about your personnel first. You need to think about operations. How are you going to develop processes? You need to think about logistics, such as supply and security and food and water and lights and power, and so all of that is a deliberate process. We really took an approach here at the field hospital that we knew we were in the Baltimore Convention Center. We had already received backing from the state of Maryland to create the infrastructure, and a private architectural firm that builds hospitals knew very well how to structure this. We received bedding sets from the Federal Emergency Management Agency, and through the Health and Human Services into the Maryland Department of Health, we had an infrastructure that was already designed above us, and so we were able to build a team. We were able to have tremendous structures that is a 250 bed hospital. So the capacity, Stephanie, is to have 250 patients. We defined our mission as patients that were COVID positive and that were recovering. So we don't do intensive care, we don't do children, and we do a recovering capacity. That allows the hospitals all over the state of Maryland to be able to resume their day-to-day operations, and we felt that that was the most service for the state of Maryland. So, without too much detail, I think what we quickly arrived at was a great team that were skilled at planning all of the operations, a great structure that is already got environmental control, so it's not going to get rained on like we did occasionally in the field, and truly not a field hospital per se, but by naming, I think it underscores that we are a contingency hospital. We're not going to create the highest quality of care that you would see at University of Maryland Medical Center or the Johns Hopkins Hospital, but you would see what we consider sufficiency standards, and those mean that we keep the patients safe and we get them better, and then we transfer them to their home once they get well.
So these patients you're seeing here have COVID-19, and you're putting them together in sort of a small space in a way. How do you prevent the spread of the disease? I guess they're already sick, but is there, what kind of controls do you put in place?
Sure, that's a great question, because we think about safety, and anytime we plan a hospital, and we have to think about the safety of the patients. We have to think about safety of the workforce. So we have what we refer to as the hot zone, and all of the patients that are coming in are COVID positive. So they've had the disease and they're infective, but they could get sicker. So our staff, our physicians, our nurses, our nursing staff are protected. They're all use protective equipment. They use masks, face shields, all that you would expect and you've heard about from all over the country and the world, in fact. And so those people, every shift, have to get into their gear. They have to come into the hot zone. They are then exposing themselves, but with that protection, to caring for the patients.
And essentially, the layout is basically cubicles, right? You've created cubicles, essentially.
Yeah, you can you can see online some of these. These are 10 by 10 spaces, and they're semi-private. They have curtains, and we respect each person's privacy. They are on a concrete floor, but they have beds that are not cots. I really would like to emphasize that the beds that we have, we received from FEMA, were contingency cots. We use those in other conditions, earthquakes, floods, hurricane relief. But we actually were very fortunate to have to be able to supply actual beds. So they have hospital beds. There's food, water, shower, bathrooms. I'm sorry, but and and a pharmacy. So I think we really do most of the essential services for a routine hospital.
When did you start seeing patients there? When did you start bringing them in?
We opened on the 27th of April.
Great. And you've been seeing an influx.
Yes, yes. Now, the trends are fortunately better than we expected, and we always want to be there. We want to be prepared for the worst and then hope for the best. But what we have seen is a steady flow. We're admitting and discharging patients every day, but I think what we're able to do is to create a place that's safe for them, that's and fosters their improvement, allows them to regain some strength. Many of these patients have been intubated and they've been extensively cared for 2, 3, 4 weeks. And now they're in their weakened state. They need some help to really recover a little more before they're able to go back to their living quarters, their facility, their home, their family.
And you are one of the first field hospitals sort of to be up and running. I know that the Javits Center in New York was probably the first.
Well, there's probably 20 or more field hospitals across the country. Each of the cities that anticipated the pandemic began at different stages. We are seeing our peak later than New York, and certainly at a lower rate. But there are hospitals in Houston and Chicago and San Francisco and really all over the country. Ours is not one of the biggest, and I don't know that it's one of the first, but we're happy to be there for the people from Maryland and support the hospitals all over the country.
What has this experience been like for you?
It's refreshing because as an orthopedic surgeon, the COVID infection doesn't really affect us. We're not experts in this. As a former military officer and as a planner, it's refreshing because it's not what I do every day, but it helps us feel we're serving. And I would speak for the physicians. We have really over 50 physicians that are here, and 1,200 nurses and nursing staff. All of them are, I think, refreshed. The energy is high. It's palpable. I feel the same way. I'm pleased to be able to lead and contribute in some way to this crisis that we're having.
Dr. James Ficke, thank you so much for joining me.
It's certainly my pleasure. Thank you, Stephanie.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.